Hi, my name is Tori Perrodin, and I'm a family nurse practitioner, and I specialize in hormone and weight management as a wellness specialist. So I really want to talk about GLP-1 injectables, and there's a lot of misinformation about it. Most people have heard of Ozempic, Mounjaro, so I want to just start with the basics and where this is coming from. I originally worked in endocrinology, so I've been using GLP-1s for a long time in practice. And yes, they were originally created for type 2 diabetes to control blood sugar levels and get A1Cs down, but they also realized that weight was coming down with GLP-1s. So first of all, I like to explain to people that although using this in the context of weight loss outside of diabetes is fairly new, the medications themselves are not new. The first GLP-1 that was FDA approved was back in 2005. So as far as safety goes, we're going on about 20 years of safety data with thousands and thousands of people using GLP-1s in diabetes. So along came more research with these that they were able to see that we can actually help people with weight management and obesity, which is a systemic inflammatory condition. It is a sometimes chronic condition, but even in acute cases where there's onset of weight gain and people are struggling to get the weight off, it can also help reverse the cycle that starts to take place whenever we do gain weight, especially visceral fat in the truncal area that puts us at high risk for all kinds of disease processes. We have disease processes of metabolic syndrome, diabetes, high blood pressure, high cholesterol, let alone even some cancers as we gain weight. So this is a very powerful tool, and the first point I want to make is it is a tool and not a cheat. For the average person coming to see me to help them with weight management, they're actually very much trying everything they can to lose weight. I'm usually very humbled and honored by the amount of effort that my patients put into trying to lose weight, and they've done everything. They've tried all the diets. Sometimes they've tried medications such as stimulants that were readily available, and they just can't get to their goal. So GLP-1 agonists work metabolically, hormonally, and psychologically. And as it's taking place of working on insulin resistance, it's working on gut hormones such as ghrelin, which is our hunger hormone, leptin, which is our satiety hormone, and balancing those, which are dysregulated from gut health issues, from insulin resistance issues, from really the exposure we have in our foods to different toxins and chemicals and processed foods. So there is an ongoing process that people are fighting. It is an uphill battle that what I want to do with the GLP-1 is actually break the cycle that is already taken place. So we have inflammation, we have gut hormone dysregulation, and then as these hormones in the gut are dysregulated and we have spikes in insulin, it actually increases sugar cravings. So a lot of people come in, what kind of cravings are we dealing with? Do you wake up in the middle of the night craving sugar? Do you have salty cravings? All of that gives me some clues of what's going on with gut health and the gut hormones. So first of all, it is a very effective tool that is very safe when used properly. So yes, this has become a fad, and there are a lot of people out there that are using GLP-1s without much monitoring. People get pretty desperate to use what is known to work, but there is a right way to go about it. So one thing I educate my patients on is any form of weight loss, whether we're talking about fad diets, we're talking about a stimulant like Adipex or gastric sleeve procedure. When you lose a lot of weight rapidly and you're malnourished and not eating enough, you will lose muscle. So the average person, as they're losing weight, a third of the weight they've lost is muscle. So when I'm starting someone on a GLP-1 agonist, one of the talks that we have is this is not about calorie restriction or malnourishment. The whole purpose of this is to help kind of curb our cravings for the junk, the sugars, the processed foods, in a lot of cases even alcohol, and better enable people to make an informed decision when they're eating that what I need to be eating is a high protein meal, high in antioxidants, vegetables, complex carbs, getting away from processed foods so that their body can be nourished. So this is not about calorie restriction to an extreme, and in fact that backfires. So when we're starting someone on a GLP-1, we do have to have that discussion of, we want to make sure that you're nourished. We want to make sure that your protein intake is high, because if I don't ensure that, then you're going to go along the typical progression, which is lose a bunch of weight, and there goes all your muscle. And as you lose that muscle, you're losing your metabolism. So the reason why the majority of different weight loss methods don't last or don't work for long, which some people say, oh, the GLP-1, as soon as you get off, you'll gain all the weight back. Well, if you did it what I would consider the wrong way, lost a whole lot of weight really quick, was malnourished, barely eating one meal a day, because you can, because you're not hungry in some cases, then if you've lost a lot of muscle, you've lost your metabolism. So you've shot yourself in the foot with your metabolism, and you'll start to gain all the weight back. And that is with any method. So people do like to blame the shot as being, one of those, well, as soon as you stop it, you gain the weight back. There is potential for that if we don't do it the right way. So the average weight loss method that people do, a third of the weight they've lost is muscle. So now, again, we have to safeguard lean muscle mass. So there's a few things too that I ask of patients to do when they're on the injectable to ensure they don't lose muscle mass. So that is high protein intake and muscle toning type exercises. Used to, we thought, okay, we have to do tons and tons of cardio to try to burn all these calories that we're eating. But now we've learned that there's much more to retaining muscle and how important it is to build muscle. So lean body mass is very important. When our patients come in, we do an in-body scan. It's a really nice high-tech scale that gives me more information than just the weight on the scale, which most people are very hyper-focused on, getting that number down. But we're looking at percentage of body fat, we're looking at lean muscle mass, we're looking at body fat mass, and what we call a muscle fat analysis. If your muscle is really low and the fat is really high, you can lose weight by any method you want. And if you do not safeguard that muscle, you could still have a really high percent body fat and have a healthier looking weight on the outside. So we do know a BMI is not as important as knowing muscle to fat analysis and body composition. So as we're working towards these goals of, we want to lose weight, but we want to lose the right type of weight. We want to lose fat and not muscle. Being able to encourage people with diets that are not restrictive diets, but increase our nutrition, increase nourishing our bodies with protein, that's where we do have longevity and success. Another thing I will add is that in a lot of cases that see me, there is something else contributing to this weight gain, whether it be chronic or acute. Hormones play a very large role with the reason why most people struggle with their weight. There's conditions in younger people such as PCOS in females, insulin resistance in general, low testosterone, and certainly perimenopause and menopause are one of the toughest times for a female to regulate their weight, regardless of how hard they're trying. So making sure that we're also paying attention to those factors is important. I do usually recommend a hormone panel if we think that there's something else going on that's contributing to this resistance to lose weight. And in those cases, when we balance hormones, replace deficiencies, and then use a tool like this to get this initial weight off, usually they have a much better outcome for the long haul, because you have to deal with the root cause. So we do want to make sure that we're, as I said, increasing our protein, maintaining lean muscle mass. But other tips that I have incorporated in all of my GLP-1 treatment plans is avoiding high-fat foods. So the reason for that is that your GLP-1 agonist does increase satiety. It does make food be processed a little bit slower, which is a good thing, because then we feel fuller and we're not trying to snack all the time or have all these cravings. So when you're eating a high-fat food, whether it be greasy, fried foods, anything that has a really high fat content, that alone is very hard to digest. So if you eat something that is slow to digest, plus you're on this injection that is making things digest slowly, you are on a fast track to side effects that are much worse and potentially complications. It is my responsibility to educate every patient that I see that as they're starting this shot, yes, there's a whole host of potential side effects, but even more so, I want to empower them to eat in a way that is not going to cause that, and also prevent complications. So side effects: nausea, reflux, heartburn, constipation, in severe cases, vomiting, diarrhea. But again, if you're pushing the system with a high-fat food, with a fried food, I've had people say, well, I'm not that hungry, so I thought a few French fries wouldn't hurt. That is so hard to digest. And so if everything is in transit so slow, it has nowhere to go but up. So either they'll have more nausea, more reflux, constipation, in some cases, vomiting. The goal as you progress along with the GLP-1 is that even if you have some side effects, each time that you take the next weekly shot, it should be improving every week. The body is adapting to it. The side effects should get less, not worse. Now, in a case, if I do see a patient and they're experiencing the opposite and they have horrible side effects, the next week they take it, it doesn't get any better or it gets worse, that is a red flag. That is the cases that I feel have coursed pretty fast to complications. So as far as the misconceptions that this is a dangerous medicine, if used improperly, when we're dosing too high, if we are eating high-fat foods with it, even if it's just a little bit and it's worsening this transit of food, that will put you at an increased risk of a complication. So as far as concerns of gastroparesis, concerns of pancreatitis, again, if you are not seeing the symptoms, the red flags early on, and you just persist to take it anyway, those are the cases that I would be worried about. So for my average patient, I do like to keep a close eye on how they're responding to the medicines. We do have two generic compounded GLP-1s that we use. One is semaglutide, which most people know the brand name Ozempic or Wegovy. That is all the same thing. And then we have tirzepatide, which are the brand names Mounjaro and Wegovy. Mounjaro and Zepbound. So those are the two main different types. They work similarly, except that Mounjaro, tirzepatide, Zepbound, that category, has two mechanisms of action and is significantly more effective. In all the side-by-side studies of semaglutide versus tirzepatide, tirzepatide does outperform semaglutide. I also find that not only is it more effective, but it is also superior in side effects, where even though it is more effective and in a way more potent, people are not having as much of this GI upset. I find we don't have to escalate the dose every time to get results, where some people do really well on these lower doses of tirzepatide, more than I have seen with semaglutide. So we do also like to recommend tirzepatide as the superior one. And really, as of now, I see it being more of a cost difference of why I would ever even suggest semaglutide, because tirzepatide is that superior. So we have these two GLP-1 agonists. They work really well. We start at the lowest dose to ensure tolerability, and then everyone is different. So what dose works for one person might not be even close to the dose that works for the next person. So as we're moving along, we are titrating the dose up based off of safety and efficacy. If someone is tolerating it great, well then great. We can go up on the dose. If you're not seeing the needle move, we're not losing the weight, then we can go up. But if someone is struggling with side effects, then we of course would keep you on that dose until you're feeling well, and give you all the tricks to get you there. So overall, since we are limited with getting access to brand name Mounjaro, brand name Ozempic, brand name Wegovy, we use compounded generic versions. Yes, there's different ways that people get their hands on this. You can try to, go to different providers, go online looking for, peptides. But what really differentiates what we use from a safety standpoint is our compounded generic GLP-1s come from 503B compounding pharmacies that have a lot of sterile regulations, safety regulations, and they give us something called a certificate of analysis, or a C of A, that lets me know that that is what I believe we're getting. The purity is there and the quality is there. So that is one thing that I do like to reassure people when they're concerned that this is not the brand name stuff, that ours is really good quality, purity and quality is checked with every batch. And I have seen really good results with compounded generic GLP-1s. And another benefit, most compounding pharmacies will mix something else helpful to metabolism or helpful to adjusting to these medicines without having a lot of side effects, such as vitamin B6, vitamin B12, because we do know that as you add in some of these B vitamins, you can actually improve the side effect profile and get more bang for the buck, where you have more energy and you just feel better on the injection. So that's been a really nice mix to where you're not just getting just that single active ingredient, you're getting more out of it. So in conclusion, these are really powerful medications that have been revolutionizing the weight loss industry, but there is a safety element that we have to always consider. There is an educational component that we always have to incorporate. So this is not just about, let me go get my hands on this shot and see what happens. This is not about getting skinny quick. This is about overall health. And so, my goal is not only to increase the lifespan, help get this unhealthy weight off, but to improve quality of life and improve health span. And when we do it the right way, we get great results. So I've been really, really excited to have this as a tool to help all patients with weight loss when appropriate. And most of them do incredibly well, especially when we're educating appropriately.